In this lecture, we'll explore the two principal classification systems for diagnosing mental health conditions: the Diagnostic and Statistical Manual of Mental Disorders, or DSM, and the International Classification of Diseases, known as ICD. The DSM is a product of the American Psychiatric Association, specifically tailored toward mental disorders, while the ICD, managed by the World Health Organization, encompasses all diseases and is employed on a global scale. Both systems serve as essential tools for standardizing diagnosis, ensuring that practitioners adhere to consistent criteria that allow for continuity in care, research, and communication across different healthcare settings. Understanding these two frameworks is crucial for mental health professionals worldwide. Let's take a closer look at the evolution of the DSM. Its journey began with the first edition in 1952, marking a significant shift in how mental disorders were categorized and understood. A landmark revision came with the DSM-3 in 1980, which omitted psychoanalytic language in favor of a more empirical and descriptive approach. This edition set the foundation for modern psychiatric diagnosis, emphasizing criteria-based assessments to improve diagnostic reliability. As the field of psychiatry has evolved, so too has the DSM, continuously refining its diagnostic criteria to incorporate feedback from clinicians and researchers, ultimately striving for improved validity in diagnosis that reflects contemporary understanding of mental health. Now, let's discuss the ICD's development and significance. Emerging in the 19th century, the ICD initially focused on general health but expanded to encompass all types of diseases, including mental health conditions. The introduction of ICD-10 included a dedicated section for mental and behavioral disorders, facilitating better diagnostic practices on a global scale. With ICD-11, implemented in 2022, there was a push for modernizing the classification system, better aligning it with contemporary mental health issues, and refining its global applicability. This evolution reflects the need for a more comprehensive approach to health classification that resonates with current medical and public health challenges worldwide. The DSM is not without its controversies. Critics often raise concerns that the manual may pathologize normal behaviors, resulting in the potential overdiagnosis of certain mental disorders. This is particularly worrying because it can lead to unnecessary treatment for individuals who might not meet the criteria for a genuine mental health condition. Additionally, there are apprehensions about the influence of pharmaceutical companies shaping diagnostic categories for profit, raising ethical considerations regarding the integrity of psychiatric diagnoses. Ongoing discussions around the DSM debate the categorization of disorders and how they align with cultural contexts and stigma, complicating the diagnosis process. Similarly, the ICD faces its own set of controversies as it strives for global acceptance and uniform implementation across diverse healthcare systems. Variations in resources, training, and healthcare priorities can impede the effective use of the ICD for mental health diagnoses. Critics argue that despite its inclusive nature, the ICD lacks the depth and specificity in psychiatric classification found in the DSM. Furthermore, disparities in mental health resources and training impact how accurately the ICD is utilized, often leading to inconsistent diagnoses across various regions. Ensuring that healthcare professionals utilize the ICD effectively remains a challenge that highlights the need for ongoing education and support in mental health practices worldwide.